Alright, hey guys, this is going over a quiz from last week, so I hope this is going to work out in a Word document with the white background. So if any of you have problems with seeing this, let me know and I can fix this. But I wanted to go over the most common things that were missed last week and kind of help you understand the thinking process behind these questions, as this will be common with your midterm and your final, and it will also help you understand medical terminology a little bit better. So the first one here, the term is prenatal, and then it's going to ask us whether this is positional, number, measurement, or directional. So the first thing I would do is I would take this word, this main word, and I would break it down so that I could see its parts, and then we can see what's going on here. That the root is nate or nato, it would be the combining form. So the other thing that I commonly do with these is I'll say here's the root, and the root is nate, and then let's see if we can get this all. The combining form is nate o, and then the prefix is pre, and the suffix is all. So now we have the word kind of broken down into its parts so that we can see what we're dealing with. So this word nate, right, prenatal or neonatal is another word. You see this? This is something that's young, that's premature, and so the process of maturation of the digestion period, and so this is kind of what we're talking about here. So now do we know all is one of these meanings that means pertaining to, so we don't need to worry about that. We need to worry about this prefix. Is this positional? Is this number or measurement, or is this directional? And almost everybody that missed this marked it B as a number or a measurement. And we're not numbering or measuring anything. The pre means before. It's clearly a positional word. It's just like if you're watching a football game, they always have the pre-game show and the post-game show, and those things are denoting a position. And the fact that the pre-game show is before the game and the post-game show is after the game. So when we're talking about prenatal, you don't even really have to know the category that this falls into if you understand the word. That we're talking about a time before birth, basically, the prenatal time, the time before. And so if you break this down, it helps you to understand that, and that's what you need to do with all of these. So this is a positional word for those of you who missed it. So the next one is hemiplegia, right? And of course here I'll just mark this. Hemi is the prefix, and plege, right? Hemiplegia, right? And so here we go. We're talking about what is this? Again, is this a position? Is this a number or a measurement, or is this directional? Well, do we know what plegia means? This means a loss of feeling, a loss of use. So you can have people that are quadriplegic. They have no feeling or use of what quad means is number of limbs. So we're talking about 4 limbs in that case. You can have them hemiplegic. You can have them paraplegic. So what are we talking about here? Hemi, it's like half is what we're talking about, right? So hemiplegic, this is definitely giving us a number here. That's what we're talking about when we talk about this is hemi is half. This is also used like you can put a hemi cap inside of a joint, which means you're replacing half the joint. You're not replacing both sides of the joint. You're replacing half of the joint on one side or the other. So hemi means half. That's what you needed to know to answer this question correctly. Without even knowing the categories if you understood the meaning of the word, then you would have done well on this. So endoscopy, this is probably the most commonly missed question on the quiz this week. And here we are, endo, we're inside, scopy, this means camera, right? And so is this a surgical, is this a diagnostic or a pathological term or adjective? So we know that they're talking about the suffix here. And when we're talking about scopy, that means that we're putting a camera inside of something, like arthroscopy, this is endoscopy. But that's what we're dealing with here, and these are diagnostic pathological terms. A scope is used to help aid in the diagnosis of a condition. If you have constant acid reflux, you'll commonly get endoscopy so they can see if there's a change in the epithelium, which could result in Barrett's esophagus, or if there's something else going on down there, if there's strictures, if there's other things. So these are aiding in the diagnostic. Now, I can see how somebody would put this in the surgical category. And so I kind of understand and see both sides of that with this. This one's probably the most tricky, I would say, out of all these terms that we're going to talk about today. And so, just like I said when we started the course, for questions like this, I do give some buffer at the end of the course because I know that some of these are a little misleading and not the best questions to ask. But anytime you do a scope, just so you know that that's for diagnostic purposes. Okay. Next one is bilateral. And again here, it's important to separate just so you get used to the whole idea of separating the prefix and suffix into parts so you can get a better idea. Lateral, we're obviously talking about an extremity here. So you can also have words like ipsilateral or contralateral. Ipsilateral means something on the same side. Contralateral means something on the opposite extremity. But here we're talking about bilateral, and bi means two. And so we're dealing with a number and a measurement. So we have two extremities is what we're talking about here. Bilateral. So make sure that you're breaking these apart and you understand the prefix, what it means. Like I said, a lot of these you can answer without, if you don't know, you even know the categories. Next word's myopathy. And so here is this word. The root word is myo, that means muscle. Raphy means surgical repair or suture repair. This is a surgical term. Herniorrhaphy is another word that you might see here. Anytime you have this suffix, you know that they're pertaining to a surgical procedure or repair, suture repair of this. In this case, it's with muscle that we're repairing it, but most commonly probably see this as a herniorrhaphy. So that's kind of what we're dealing with there. So make sure that you're familiar that this is a surgical term. Again, if you know the meaning of this, you don't even have to know these. You know that this means a suture or surgical repair or something, and you'll know the answer to this. Make sure you're separating these. I think that that's a key. Make sure that you know that, okay? This is one of the most confusing questions. I think people miss it on all the quizzes. I think it's very confusing for people as far as diarrhea goes. And it is directional, and this rhea means the flow across a membrane or movement from one place to another. And so I think this is one of the most confusing terms on the quiz. But now that you've kind of seen that, you're going to see this applied to other terms like pyorrhea. You're going to see throughout the semester. So you're going to have to know that that's directional. That means the flow of infection or pus, pyorrhea, and here we have diarrhea, the flow of stool, and so it is directional, denoting the movement of that. Next term here was electrocardiogram. Let me put these back in red. Hopefully that helps you with the seeing of them a little bit better. But electrocardiogram, right? So here's a term where you've really got to break this down. Here's the combining form for cardio, right? And the last word is gram, right? So here's the prefix electro, here's cardi, that's the root. There's the combining form, and there's the suffix gram. So what does this all mean? Well, we got to look at the categories to know what they want us to look at here, right? And this is surgical, diagnostic, or adjective, right? And certainly an electro, what is this? Cardi is the heart, so this is a test, right? A gram, a measurement, right? Electrocardiogram is something we used in diagnosis, and so this becomes a diagnostic term. It's a test that is performed to help with diagnosis of heart conditions. So that's where you fall into as far as electrocardiogram. Make sure you're breaking these up. Another term, adduction, right? What is this? This position? Is this number? Is this direction? This is direction, adduction, right? The movement, add, is movement towards the midline. Ab is movement away from the midline. Adduction is the direction. So here we go, adduction and abduction. You have to know the difference between those two terms, and this is definitely a directional term. And so hopefully that helps you to understand that. And then this last one, of course, keep breaking these apart. I would highly recommend, even as you're studying, that you're breaking these apart, that you're understanding how things go together, right? Intercostal means your ribs, right? Intercostal, right? So what is this? This is definitely positional, right? Inter is the space between the ribs. That's what this is pertaining to, our intercostal area. And so it's not direction. We're not going across something. We're not going through something. This is the position. When we say we made an intercostal incision, we made an incision in the area in between the ribs. Or we took an intercostal approach. That was our approach to the surgical, right, site, to the tube that's being placed, to whatever. It's in that intercostal area, or that position between the ribs. It describes a position on the body, and so you need to know that. So those are the most commonly missed terms that we talked about from this last week. I think the key to medical terminology, and one thing I wanted to show you, is being able to break these terms up, to know the prefix, know the suffix, know the root word, and know the meaning of each word. Last week was a lot of information, and so you probably don't know all the meanings to everything. That last week's quiz is unique. The quizzes going forward are all going to be based on a system, so you'd be much more focused. But you do have a midterm and a final that are going to be comprehensive. So you need to be, as you go forward with these, you need to be reviewing. You need to keep these things fresh in your mind so that you know the meaning. Anyways, if you have any questions, please let me know, and have a wonderful week.